All right, I think I'm gonna get us going. Thank you everyone for being here. This is a really exciting event for me, and I think for everyone in the SSDP network. This is the first time we've held an International Women's Day panel, to my knowledge, and it's a really nice thing for us to be able to hold, especially since we have such incredible leaders across the network and in this drug policy reform space. And especially since the movement we're working in is so important for us to look at different types of discrimination that exists in the world for us. And yeah, so thank you so much. This promises to be a really great panel. My name is Róisín Downes, and I'll be taking you through, I'll be moderating. And I'm the Executive Director of SSDP International, which has just been recently founded. So yeah, so the way I'll get us started is I'm gonna give us like a few little introductions to our panelists today, and we'll see how they are and welcome them a little bit, and then we'll go into a few questions that we have prepared, and then at the end, if we have some time, we'll do some questions from the audience. All right. So first I'd like to introduce Ailish Brennan. Ailish is the current executive director at YouthRISE and also a member of SSDP Berlin. Ailish recently authored a really insightful chapter about queer feminine identities and the war on drugs in a recent publication entitled The Impact of Global Drug Policy on Women, Shifting the Needle. Ailish has been involved in harm reduction and drug policy reform since 2017 and is particularly passionate about homelessness and LGBTQ+ issues and how they intersect with drug policy. Ailish, how are you doing? It's good to have you here.
Yeah, it's really great to be here. Thank you for the invite to the great panel. Thank you for giving me the opportunity to share the space with some amazing women. I'm doing really good. It was a really beautiful day here today. It's a public holiday in Berlin as well, International Women's Day. So I gave myself the afternoon off to go and enjoy the sunshine. So I'm in a really good mood now.
Well, we're delighted to have you here, especially on your day off as well. Thank you so much for being here. Next, we have Lillian David. Lillian is a graduate of Federal University of Agriculture, Abeokuta, who started her career as an NGO strategist and a public speaker in the African Students for Liberty network. She is currently a champion advocate for Women for Liberty Africa, which is her newly founded think tank, and also is a board member of Students for Sensible Drug Initiative Nigeria, and has been long involved in student activism. Lillian, it's great to have you here. How are you doing today? You're on mute there, I think.
Sorry. Thank you, Róisín. I'm really excited in the midst of great women. I'm very, very excited, and I look forward to everything that will happen today. Queen, hello.
It's great to have you here. Thanks so much.
Thank you.
Next, we have Iulia Vatau. Iulia is the founder and chapter leader of SSDP University College London and a board member of SSDP International. Iulia has also been a key actor in the re-establishment of the SSDP UK network. And furthermore, Iulia has played a big role in the development of the SSDP International global structure and has developed a volunteer project in her local chapter based on SSDP's peer education program, Just Say No. Iulia, it's great to have you here.
It's so great to be here. I'm extremely honored to be part of this panel and hear from such amazing and inspiring women. It's truly amazing, and I cannot wait to share insights and see what everyone's been up to.
Thank you so much. And thank you so much for being here. Rita Gatonye. Rita is the project officer at Focal Kenya. Focal, for those who aren't familiar with it, is Voices of Community Action and Leadership, which is an advocacy and drug policy organization. Rita is also a former drug user and is a current human rights activist and law student. Rita, it's lovely to have you here, and I know it's really late in Kenya, so thank you so much for being here so late at night as well.
That's okay. Thank you very much for having me. It's nice to meet you all. I'm looking forward to hearing all about all of your work and all of your experience. And you know, it's late, but it's worth it. So nice to see you all. Looking forward to it.
Thank you so much for being here. Next we have Rachel Wissner. Rachel, as many of you will know, Rachel began her time in the drug policy reform world in 2011 when they joined SSDP in sunny New Paltz. And since then, they have led an outstanding career in drug policy, and not the least of which was becoming interim executive director of SSDP at the age of 27. Before their time working for SSDP, Rachel worked as an outreach associate for Family Law and Cannabis Alliance, advocating for families impacted by the war on drugs. Rachel, it's great to have you here. How are you doing?
Thank you. I'm doing well. Thank you for having me. I'm honored to be here.
Thanks so much. I'm delighted you're here. I'm not sure if we have Odunola on the call. I just want to check just to be sure. Oh, we do. I see it now. So Odunola served as a member of the board of directors of SSDP in 2017-2018. And during her tenure, she represented SSDP Nigeria and participated in SSDP's peer education program, Just Say No. Odunola and her team members have facilitated educational programs aimed towards reducing drug-related harms in Nigerian high schools and universities. She graduated from University of Ibadan and is a certified Nigerian lawyer. She recently earned a master's degree in women, gender, and sexuality studies at Oregon State University. Odunola, it's great to have you here. How are you doing?
Yeah, I'm good. Thank you. Here, so thank you.
Lovely to have you here. Great. So now that we've gotten to know everyone, let's jump into a couple of questions. Let's start with, okay, I'm trying to think who I'll start with. We'll start with maybe Iulia. Iulia, as someone from Romania and living in the UK and doing so much work around drugs, policy and harm reduction, I'd imagine there's some like stigma to face in those areas. Can you share, how you've seen that and what your experiences have been kind of coming up in SSDP so recently?
Definitely. I think I was a bit more privileged in the sense that my drug policy work sort of started in the UK in a university that's pretty open to the idea of harm reduction and sort of drug education. And I'm aware that's not something everyone has. So a lot of my development and my work as a drug policy reform advocate has happened within that context where I didn't necessarily experience a lot of stigma. We were really lucky to be able to work with our student union and have them so open towards having harm reduction on campus and harm reduction workshops. And I think in a way that also translated at the UK level. I think there has been a lot of work that has been done in the last 20 years in the UK that really helped mitigate some of the stigma that is around drug users and drug policy reform advocates. And this is something that SSDP UK and I are eternally thankful to the people that came before us and did such amazing work to start a conversation around it and sort of generate discussions around drug policy. We have amazing drug education charities here that have worked in schools and that have imparted a lot of experience to us, and they just made our work a bit easier. And I guess now with having a movement that is dominated by young people, I think it will become even more mainstream, and we will actually get to see some reform because it's slowly becoming destigmatized, even in mediums that may not be considered as safe as, for example, a university in London. When it comes to Romania, however, that's quite a different story. I think Romania is quite in a different development stage when it comes to civil society activism in general. We don't have a civil society that is empowered enough. And that has affected the drug policy community and the drug user community in ways that sort of prevented them from doing any work to destigmatize this subject. We have issues even with sex education at this point. Drug use, it's even more controversial. But I think there is hope. And personally, I haven't necessarily experienced a lot of stigma me in Romania because most of my work has been in the UK, but I have talked with a lot of activists there, and they seem a bit discouraged at this point just because it's a very slow process of making the entire civil society there credible and an actual force of change. And I think that also has to do with politicians and how politicians don't necessarily see civil society as more than maybe accessing European funds. So there are problems with that. I do want to go and start a youth movement there. I do think that the youth movement is going to be the one that's going to start the conversation and destigmatize, and maybe in the process revitalize the civil society altogether there. And I do hope I'll be able to do that maybe from the summer onwards, and hopefully start some drug education there, harm reduction, and get the conversation going.
Thanks so much. And it's such an inspiring vision as well for civil society in Romania. I really love that. Next, I have been remiss and Miss Queen in our introductions, but this is just due to my nerves, so my apologies. But and Queen, I'm sorry, but so Queen is a policy manager with the Drug Policy Alliance in Washington, D.C., where she works on federal and DC specific policy initiatives, often focusing around cannabis reform through a racial justice lens, decriminalization, and the consequences of previous convictions. Queen is a first-generation Nigerian American and has strongly supported the SSDP Africa network over the years, particularly playing an extremely key role in the registration of SSDP Nigeria as an NGO, which just recently passed. Queen, welcome. How are you doing today?
Thank you. No, it's all good. I'm doing well. I'm excited to be here. Yeah, it's good to see everyone, especially all the folks from the continent. Very happy to see everyone here.
Great, and I'll go to you first for the next question here. So in the United States, the racial motivation behind the war on drugs is so visible. And as a Black woman in the reform movement, how have you experienced the drug policy reform space? And has the role of Black women in this space changed over time, do you feel?
So I would say, you know, the drug policy reform space that I've kind of operated in for what, like 5-6 years now, has really been dominated by white people and men in particular. And that's been really difficult because of how the war on drugs plays out in the US in particular. Like, it's very much rooted in xenophobic energy, white supremacy. And as a child of Nigerian immigrants, you know, it's very clear to me just the ways that white supremacy is not just, you know, a United States issue, and it's global. And really understanding how colonialism has impacted not just my parents' home country, but the world. And it's just really frustrating being an advocate in this space when, you know, you have to convince people why racial justice is important. And then seeing how people end up turning like that sentiment into a talking point and using it as a strategy instead of like an actual principle. So, you know, it's often frustrating for many Black folks in the drug policy space, having the conversation about race and having to always be the voice pushing behind, you know, race in conversations. But I would say the space is changing in certain ways. You know, there's been a concerted effort by a lot of folks, especially Black advocates, to really, you know, build out the drug policy reform space, where it's not just people who are focused on drug policy, but really connecting the dots, because the war on drugs and drug policy is so interconnected to so many different issues. So many different things can bring people to the table. outside of just liberty, which, you know, I value myself as well as a person who uses drugs. I think liberty and autonomy is at the root of, you know, why drug policy is so important. But, you know, it's beyond just access to using drugs that really has me at the table, at least. And I think, you know, building that out and cutting across movement spaces has helped to bring more people of color into the space, and also highlighted people of color who already existed in the space but have been silenced because of, you know, just the dominating voices in the space. So, you know, I think there's still a lot of work to be done around intersectionality and bridge building across communities, but, you know, I think it's critical that it happens.
Thank you so much. And yeah, it's really insightful hearing that. And yeah, I think next we're gonna go to Lillian. Lillian, you have started a think tank called Women for Liberty Africa. I was wondering if you could tell us a bit about this organization and what it's like founding a female-specific organization in Nigeria at the moment. Oh, I think you're on mute again.
Okay. Thank you, Róisín. Can you hear me now? I assume you can hear me, right? Okay. So Women for Liberty Africa is a gathering of strong women that are bold enough to tackle issues concerning women. So the organization came about the realization that there are so many things that borders around women that are not being taken care of. And we have professionals, we have strong women, we have strong brains, strong minds that could actually take care of these things, but they are not accessible. So Women for Liberty is an organization that brings these women together so that the underprivileged women and some other people that might need their help will be able to access them, to make them readily accessible for these women. So it's a gathering of strong women. We are trying to create a chain that would be sustainable, a chain of strong women that would help other women that are not up to them. So when we're trying to, the team and I, when we're trying to talk about how the organization was going to be formed, we looked at three things majorly. We looked at the strength. So we search out for strength. We don't want to just gather women together, but we want to gather strong women, women that are able to take up responsibilities, things that don't concern them, things that don't pertain to them, but they are really eager to help with whatever way they can. We looked out for that readiness, the readiness to take that responsibilities. We looked out for actions. We wanted women that are ready to take up actions that will challenge the world to do more, that will challenge women to come up and speak, that will challenge women to come up and contribute to things that concerns development and change in the societies. And in Nigeria, it's a tough one because we have so many stereotypic issues that borders around women. And when you come out to start an organization of such magnitude, you are being questioned, you are being harassed, because people want to understand why you take it upon yourself to gather some women, call them strong women, and you feel there are issues that borders around them and it's not being attended to. So we face some stereotypic issues like you are trying to build a coalition of women that will be obedient and rebels. You get issues like people start to question the reason why that organization is being formed. Are you trying to give women the power that they don't deserve? Are you trying to give them power to be very rebellious, and when issues that pertain to them are being discussed, they are on the other side of the table saying things like they are bigger than men? So those are most of the issues that we had to tackle. Then we started having issues concerning the fear. Women started to exhibit fear, that approach to their problems. They hardly talk about it because they feel that the professional space that Women for Liberty was building was too do I call it cohesive for them. It was too strong a bond for them, especially women that feel less of themselves, they feel underdeveloped, they are not able to reach out to this women. So these are some of the challenges that we face, but thank God we are advancing every day and we are trying to devise means on how to bridge this gap. We have professionals and the organization was created to build professionals. But at the same time, we are trying to build that gap between professionals and the underdeveloped women. That is what Women for Liberty is all about. It's a strong coalition of women that is out to help others. So that's what I can say for now until I get questions. Thank you very much, Róisín.
Thank you so much. And it's so laudable, like, you know, trying to increase access in this way, and that you've been able to overcome those challenges in such a strong way as well. All right. So I think next we will go to, let's go to Rita. Rita, as a woman who used drugs in East Africa, could you tell us a little bit about your lived experiences and how you came into the world of advocacy over the years?
Okay, I hope you can hear me.
Yeah, we're getting you.
Let me just put my video. Okay, so my video has a bit of a problem. But so just to answer your question, yes, my lived experience is, of course, what got me into the advocacy space. And how that happened is because I think I want to agree with Lillian that already access to services is an issue. Already for any woman who uses drugs to believe in themselves and to be brave enough to start something was an issue. So in the process of I want to call it recovery, the process of harm reduction, in the process of being at the methadone center and having no young women actually in the policy reform space, but having some people trying to begin to work with, trying to begin a drug policy reform organization, I just found myself asking the right questions, so to speak, challenging people at the clinics, just asking the sort of questions that needed to be asked. For example, we have a lot less women in the centers, and when they come, some of them were being turned away. Things that really seemed pedestrian, but were not. So in the process of that, and also having studied law before I got into problematic drug use, so just being the noisemaker, so to speak, and just having to bulldoze my way through a lot of the services, I came across this organization called Vocal Kenya, which had just begun working in the drug policy reform space, and it served as a platform where I could take the evidence that we all needed for increase of services, for opportunities for people who use drugs. So the minute I saw that opening, that there was actually somebody working in drug policy reform, then of course I jumped at it. So primarily from the beginning, my work has been to there's my video. So my work has been to make the case for why things need to change, just from my own story and from the stories of the women around me, and that's how I got into the policy reform space. Just I don't want to say as a joke, but just like that. But then I came to realize that it's very important, and for not having women there had been a really big problem, because well, the men speak on behalf of them, but there are some things that they just cannot understand. So that is how I got in there, and that is how I'm here.
Thank you so much. And yeah, I want to echo what Edie said in the chat. Thank you for highlighting the kind of the deficit that exists in these spaces. And yeah, so I think next we will go to Ailish. So you recently authored a powerful chapter about queer feminine identities and how they intersect with the war on drugs. And during that chapter, you talk a lot about the politicization of these identities and how that affects the access to things like healthcare and general societal things like education. For those who aren't familiar with this sort of thing, could you share some insights around that and maybe a little bit about what access is like in the advocacy space as well?
Yeah, of course. Just to plug the book again first, you mentioned at the start it's called The Impact of Global Drug Policy on Women, Shifting the Needle. It's available online as a PDF for free. You can also buy it if you want to as a physical copy. Of course, you should read my chapter specifically, but there's many, many other amazing chapters in there. There's a lot of really amazing women who contributed to this book, who I really admire and look up to. And in fact, I was quite nervous and starstruck when I was writing it and when I was speaking at a book launch recently for it. So yeah, my chapter, as you mentioned, is about queer feminine identities and how they interact with the war on drugs. There's really no research or very much written about this. So the chapter was very much written from my own perspective as a transgender woman. I am also in a relationship with another woman, so there's like an added level of queerness to my identity. I think my partner is watching this, so she'll be very happy to get a shout out in this presentation. I fit quite neatly, I would say, into a gender binary. I'm very content with my identity as a woman, and I feel comfortable with that. However, I'm aware there are many people who don't fit so neatly into a gender binary, who are impacted by the stuff I'm going to talk about and the stuff that I wrote about in the chapter. So I tried to give reference to that in the chapter. If you do read it, you'll notice that. That being said, I'm not non-binary, for example. So it is still mostly from my own experience and the experience of my community specifically. The intersection of queer women and the war on drugs sort of tends to compound discrimination that both communities experience. Both queer women and people who use drugs can often struggle to access housing, education, healthcare, among other things. In many countries, both communities are ostracized from society or criminalized, which can often push us further into criminalized activities as a result of being unable to access employment. Accessing essential services such as healthcare is a big issue for transgender people specifically. Accessing hormones here in Germany is quite a lengthy and difficult process. It is also a significantly more traumatic process in Ireland, where I'm originally from. In Ireland, there's just one clinic able to give you access to hormones, and the waiting list can be around 2.5 years. They've been known to insist that adult patients bring parents to assessments, which is something I don't think anyone would want in a medical setting, let alone a community which has a really strained relationship with their parents a lot of the time. In Germany, until quite recently, your transness was assessed based on criteria such as how you walk, to see if you're trans enough to be able to access hormones. In many clinics here, you still need to fit into a very narrow gender binary. And I know of many clinics where doctors actually are just what I would describe as very homophobic, and they'll be very reluctant to give you access to hormones if you're in a same-sex relationship. This obviously means the situation is extremely difficult for many trans women who do not fit society's traditional expectations of a woman, let alone non-binary or other gender non-conforming people. I'm quite lucky. I have a really great doctor at the moment who prescribes my hormones, and he does quite a bit of harm reduction work in Berlin. However, in the past, there was a very real possibility that if a doctor found out about my drug use, or even in some cases the gender of my partner, I wouldn't be able to access this healthcare. I'm speaking here about Germany and Ireland because they're the two countries that I know about. But these are really by far not the worst when it comes to transgender healthcare. I think in the grand scheme of things, they're probably one of the better examples to give. And still, this is really like below par, really not what it should be. For people who use drugs, accessing healthcare can also be very difficult, obviously. Disclosing your drug use to a doctor is often not an option, and even trying to access explicitly drug-related healthcare or harm reduction is not always possible. Access to harm reduction is extremely poor. The UNODC estimates that less than 1% of people who inject drugs live in countries with high coverage of both needle and syringe programs and opioid substitution treatment. This is like obviously not good enough, and 99% of people who use drugs are clearly being left behind here. Most data available says that the majority of people who use drugs are men, and the vast majority accessing services are also men. For that reason, most services are centered around men, and are working to meet the needs of a community of people who use drugs that is almost all men in some cases. Women, in particular queer women, are not having their needs met by these services, not only because we have nuanced needs, but also because services are not meeting the needs of the majority of people. There are very few examples of best practices for queer women accessing services. Medicineres in Barcelona being one very good example. But across the world, queer women are being left behind as a result of policies that don't value harm reduction or the lives of queer women who use drugs. Bringing it back to the theme of the panel, and queer women are also struggling to access opportunities that I have to engage in advocacy work on issues that impact us. As you'll all know from being either a young person who uses drugs or a young person who advocates for better drug policies, when you're part of a certain community, there's a lot of time spent by people who aren't you talking about what is best for you. I was going to say this is also the case for queer women, but queer women who use drugs, but in a way it actually isn't, because these conversations aren't even happening. In many instances, there's just no one there to start the conversations. When I go to places like the Commission on Narcotic Drugs at the United Nations to do advocacy work, there's not many people like me there. There isn't exactly an abundance of transgender women who use drugs present at these meetings, and there isn't exactly an abundance of even queer women or queer women who use drugs. For this community looking to advocate for our own rights and access to healthcare, not only do we have to overcome the obstacles I mentioned already, and many more obstacles I don't have time to mention today, there's also very few opportunities for us to really start talking about the issues that we face. That's one of the reasons I was so happy to be able to write the chapter of the book, and also why I'm delighted to speak here today. I made a presentation on last Wednesday at the launch of Shifting the Needle, where I spoke a lot about some actually really horrible personal experience I've had. But I was really happy to do this because I know if I don't share these experiences, there's not many other people like me with an opportunity to share them and talk about how we can try to fix them.
Thank you so much for that. And I think now is a good time to note that we are talking about some very large things in very short amounts of time. And I hope that everyone takes this opportunity to take a look a little bit deeper into all the work of all of the people on the panel. And particularly, I'm sure you've all been really compelled by what Ailish just said. And it was, as always, you're an incredible speaker. But you know, if you want to see more of that, like, please, you know, buy the book. It is there, and the chapter is really incredible, and I highly suggest it and recommend it. But yeah, thank you so much for that, Ailish. Next, I am going to go to Odunola. So Odunola, you're a registered lawyer in Nigeria and also hold a master's in women's gender sexuality studies from Oregon State University. I feel like you have a unique perspective, having seen both American and Nigerian culture around women. Could you share maybe some of your insights and your experiences from around that?
Okay, I'm here. So, so thank you for inviting me one more time. My name is Odun. So some insight I would like to share about my experience having been or observed the Nigerian culture and the American culture. So firstly, I would like to say that I'm from Ado, Nigeria, southwestern Nigeria specifically, and I so much appreciate what Lillian said, because that kind of connects to what I've experienced as an advocate and as a woman. So that's interesting to know. So based on my experience, I would like to say that we have different challenges faced by women in Nigeria and definitely in the global world, of which America is also inclusive. And I can say that we have like two biggest challenges that we face, specifically gender and sexuality, just like what Ailish said. That was so informative. So I have learned that the cultural and social constructions of gender and sexuality really play a major role in our decision making in whatever we do. So we know that different things are affected by different people, but basically I want to focus on women, because when we talk about how issues affect beings, I really would love to focus my attention on women, because we all know that when it comes to giving priority to gender, we give more priority to the men. So we know that women are affected a lot in terms of different things. So based on my observation and my experience in America, I've realized that there's a need for us to address issues from a transnational feminist lens. And what I mean by this is that there's the need for us to consider why certain communities do what they do, or maybe engage in different things. And when we also want to like prefer solutions to any problem, we should also consider the need to maybe tilt our suggestions or maybe solutions towards what would be acceptable by different society, because we all come from different backgrounds. So that's what I have come to realize and really appreciate. And that's been like a part of what I'm going through. It's like a process for me. So, and there's also need for us to note the intersectional factors that influence us. So when we talk about women in this category, like what are the intersectional factors that kind of still maybe limit us in terms of not being visible in society? So when we talk about gender and sexuality, which I talked about, I believe these are like the systemic issues that it's quite difficult for us to maybe ignore, because they are just like the systemic issues. So how can we address these issues? And when it comes to maybe reproduction, family, so how can we address these issues to like maybe to make us understand different things affecting women, and not only women, like the people with different sexual orientation, like queer people as well. So LGBTQ communities. So we also need to consider that. And this kind of makes me want to connect it to Nigeria as a whole, and talking about the issues that we have about the unfavorable drug policy reforms that we have. So a practical problem in Nigeria, that was in 2018. I could recall there was this proposal being issued or raised by the Nigerian government to increase tariffs on alcohol and tobacco use. So I don't know, when the proposal was made, I kind of, I was just thinking out loud that rather than for us to, or for the Nigerian government to maybe state the specific things that we need to do, like maybe we need to increase tariff on alcohol and tobacco use, why not just address the intersectional factors, or maybe the things that are kind of causing maybe unsafe consumption facilities, or maybe the things that are maybe hindering people who are using different substances. So something like that. So there's need for us to like address that. And also, so I believe that based on that, we should start responding to maybe questions like the rooted issues that affect women, and also how maybe those rooted issues can be discussed so that we can maybe talk about the need to provide or to establish quality drug policy reforms. So, and also my philosophy about life basically is to, my philosophy about life is that everyone has a role to play in whatever we do. So I believe that addressing these intersectional factors would help us talk about how we can promote better drug policy reforms in Nigeria and versus what I've been seeing here in America. So it's interesting to know that. Thank you.
Thank you so much for that. And I really appreciate your philosophy, and it's really interesting to hear such to hear the kind of the way the narratives are different and what needs to be addressed. I really appreciate that. Next, I am going to go to Rachel. Rachel, you previously worked in reproductive rights of women who use drugs. This is an area that some people in the drug policy reform movement might see as a bit of a sticky subject or might not be as informed upon. And oftentimes pregnant women, or the ability of some women to be able to become pregnant, is weaponized as a way to justify some like war on drugs policies. Can you tell us a little bit about your experiences working there, and what do you want people who are in this movement who might not be as aware about this sort of topic to know when they're kind of beginning to address it?
Yeah, thank you. That's a really, really fantastic question. So my first drug policy reform job was working for the Family Law and Cannabis Alliance. And we offered non-legal advice and legal referrals to women and parents and pregnant people who were facing CPS, which is in the United States, that's Child Protective Services actions for their cannabis use. So we specifically worked with cannabis. So that's where I'm going to speak from. And so usually CPS would find out about and women were particularly targeted, right? Women and people who can get pregnant are particularly targeted, by CPS for cannabis use more than men. But usually CPS would intervene because of busybodies. So a neighbor would call CPS if there was cannabis use coming from the house, or CPS would be contacted from a hospital, right? Or a doctor's office or something like that. Which were very common. And so so in the state, the laws in different states really vary. It depends on, in the United States, it depends on where you're located, because Child Protective Services are state agencies, and the policies differ from place to place. But in particularly in states in the South, in the United States South, had very, very strict punitive laws, whereas it would be a little bit more liberal elsewhere. And so people have had their parental rights terminated for cannabis use, which means you can no longer be a parent to your child. Legally, you have no relation to them, and that is very extreme. And no, that does not happen to anybody who uses alcohol, right? It was cannabis, and so lots of people like will, you know, can drink around their children and it's like never an issue, right? You know, it's an issue like drinking while pregnant, because that study showed that like that does lead to birth defects. But you know, people can enjoy alcohol with their children present and they are not criminalized for it. And so like there would be a range of actions that you could face from CPS if you were found to be like smoking cannabis and a parent. Like, you know, you could have like custody taken away temporarily, and you could just, you know, face custody taken away, or, you know, given to a different parent. Like, you know, if you were divorced, like you could have your custody like taken away, and like the child now only is, you know, custody in like the father, right? And then also like, you know, parental rights terminated. And this would happen. It doesn't matter what the legal state of cannabis was in your state. Like, for example, in California, where cannabis is legal, like, you know, after giving birth, like women could be like drug tested. And if you tested positive for cannabis, you wouldn't get to go home with your child after you gave birth. Like CPS would come and take your child away from you. And so there are no studies that demonstrate, there are no significant studies that demonstrate that cannabis has any kind of impact on a fetus, you know, whatsoever. You know, the same actually goes for, you know, a number of different drugs. Like really, you know, the one that's the most harmful is alcohol, actually. And so drug testing, I'm jumping around a little bit here, but so in hospitals, drug testing the mother after, you know, she gave birth is more common for Black women, Latinx women, and like people on Medicaid, right? And so, you know, the war on drugs is very racialized in the United States, and like people of color are criminalized. And so like, you know, women of color are, you know, more likely to be drug tested without their consent in the hospital, and people on Medicaid as well, because you're on government health insurance. And so like you're subject to a whole bunch of different things. And so, yeah, like people will have their child taken away, like can't even go home, you know, from the hospital with them. And the other thing that's like, you know, particularly devastating about having like custody rights taken away for cannabis use is like, if you're a, and this will happen even if you're like a medical patient, right? Like there's this, like in legislation where cannabis is legalized in different states, there are usually no kind of reforms for parental rights at all. Like that's completely like not included in legislation. And so like the same prohibitionist policies will apply to you even if like cannabis is legal. So for example, California, like which I just mentioned, you know, you could have your child taken away from you after birth, right? And so it's particularly upsetting, you know, for medical patients, right? Like if you are a chronic pain patient and you're bedridden because you're in so much pain and cannabis is the only thing that helps you, like that's how, like that can help you like have the energy to be a parent, right? If you are like bedridden from chronic pain, how can you take care of your child? If cannabis is helping you like be a parent, then like that is awful that you're punished for that, right? And so like we need to respect people's rights to use cannabis if they're parents. And so even in states that are legal, like we do need to change those laws. Like there's no provisions in legislation about that. And so, yeah, there certainly is a lot of stigma around like, you know, parenting and drug use, but I'm not going to speak to other drugs because my expertise is in cannabis. But really like ultimately we need to like respect women's choices to put what they want into their bodies. If they're not like, if they're otherwise like, you know, being wonderful parents or just good parents, like why are we criminalizing people for using cannabis still? Like, I mean, we all agree we shouldn't do that, but like there's no reason to take someone's child away because they use cannabis. You know, we don't do this for alcohol, right? And I lost my train of thought, but there was something else I wanted to say. Yeah, and so like, you know, that this kind of like, you know, your ability to get pregnant and being a parent like is weaponized against cannabis users. And yeah, so we really do need to like, in states that are already legal, we do need to change the laws and like and like allow people to like, you know, CPS to not get involved. And so I didn't speak to how problematic CPS is, like Child Protective Services is very, very, very bad, right? It's not like, it's just like how our criminal justice system is incredibly racist and classist, and is not really doling out justice, right? We all know that. Same thing goes for Child Protective Services. It's a state agency, right? They operate under like, you know, white supremacist patriarchy still, right? Like, you know, getting CPS involved is like actively harmful. Like the foster care system is very broken. Like, so, you know, for example, if a parent who uses cannabis gets custody taken away and their child gets placed in foster care, they're very, like that child's very likely to be neglected or abused, right? When they could have just been with their parent. You know, because our foster care system has a lot of neglect and abuse in it. So CPS really does need to, I mean, I'm an abolitionist. So I do believe that like CPS needs to be abolished and replaced with something else because it is very, very harmful as an institution. So I also want people to like come away with that. Like, you know, calling CPS is going to bring some harm to someone's life, right? If you're concerned about like child abuse or, you know, parental neglect or whatever, like, you know, talk to people that you're in community with. Don't call CPS. It's like, don't call the cops, don't call CPS. So I want people to walk away with that understanding here, as well as like, you know, we need to respect people's rights to use drugs. Like if you're being a good parent, if you're responsible, like you should not have your child taken away for something you put into your own body. Yeah, does that answer your question? And I was a little all over the place.
Yeah, no, it definitely did. And I think it's been really insightful, especially, I think this is something that SSDP in particular hasn't looked at too much, but overall it's a really kind of niche area. But Scott has a follow-up question here. And the question is, when hospitals non-consensually drug test people who give birth, is it typical for both parents and or the partner of the person who gave birth to lose child custody rights?
Yeah, so that's a really great question, Scott. It actually depends. So like if you're a single mother or single parent and you gave birth and you were drug tested non-consensually, right? Yeah, and so yeah, another thing I mentioned like vaguely is that these drug tests happen non-consensually, which is like not okay. But you will, like the parent who gave birth can get their custody rights taken away if they're a single parent and given to the other parent, or the child will be placed in foster care if the other parent is not involved, right? So for example, if they're divorced, like, you know, the custody will be given to the other parent that's divorced. If they're, you know, if they're currently partners and like living together or something, that child can be like just placed in foster care and not given custody to the other parent. Like they would be like literally removed from their home, you know, and like both parents to go into like foster care. Yeah. Thanks. That's a great question.
Thanks so much. Well, we have more follow-up questions for you, Rachel, but I will say we're going to go into like our Q&A section now. So if people want to throw their questions in the chat or use the raise your hand function, and we'll unmute you and we can go into more Q&A. But yeah. So Dash had the question, does the partner ever get tested? But I think you answered in the chat. Or Queen, you're welcome to come off mute if you want to explain further.
Yeah, I just wanted to add to that really important point that, you know, it's not even for cases where custody isn't immediately taken away, it often ignites consistent surveillance by CPS, which, especially for families that are living in poverty, is really detrimental and ends up getting to the point where someone may end up losing their child just because they consume cannabis. So I just wanted to add that into the conversation and thank Rachel for bringing this up.
Thank you. Our next question here is for Ailish, and this is from Sorka Ryder. I'm from Ireland, and the slow advancements being made around a more health-based approach to drug law has made me very hopeful, i.e. new capacity of the police to deal with cannabis possession without warning instead of court proceedings. What are your thoughts on how Ireland is moving with this, and how would you recommend getting involved in this area of drug policy reform?
Hi, thank you for the question. That's a really great question. I think in Ireland, things are moving very slowly. I think many people say this about their own country, wherever they're from. They feel like things never move as quickly as they want to, but I definitely hold this view about Ireland. I think even when you're looking at like the injection facilities which have been planned for so long, the reason I actually got involved in drug policy was because of these facilities. The law was being changed around them when I started in university, and then I studied politics, so I started researching them a little bit more. For those who don't know, Ireland legislated for medically supervised injection facilities, I think is the exact phrase they use for them. So yeah, they changed the laws to allow for these facilities to be brought in, but that still hasn't happened. Like 4 years later, 5 years later, there's still no place for people to consume substances, despite the law saying that they can be. A license was handed out to a specific clinic, in fact, to a specific harm reduction centre who works with homeless people quite a lot as well. They do a lot of great work, actually. They're called Merchants Quay Ireland. But nothing's happened on this. It's just been blocked and blocked and blocked by local complaints and stuff like this. So I think with everything, there's a lot of issues around this. The same with the law that you mentioned about a warning instead of going to court. This doesn't just apply to cannabis. This applies to all drugs, actually. For the first warning, for the first time you're caught in possession of a substance, you'll receive a warning. The second time, the police can decide basically if they want to give you a warning or if they want to send you to court. And then the third time, you get sent to court. In this particular case, I think this is objectively a better policy than what is there at the moment. That being said, it's not a good policy. I don't think this is a good policy. I think that this is a policy that will harm people who most need health-based drug policies, and much more harshly than those who don't. If you're an upper middle class white person working in a massive bank in Dublin and you're using cocaine on the weekend, you might get caught once. You're probably not going to get caught again. If you're a street-based person who's using drugs, has many interactions with the police, you're going to get caught multiple times and you're going to end up in court. When really it's these people who are experiencing drug policies most harshly who need the health-based approach, who need better changes to be made. It's a really classist policy, it's a really racist policy, and it will really only harm people who are really marginalized, and it will only benefit people who are already benefiting from drug policies, really. To move on to your next part of your question, I guess, one of the ways I got most effectively involved in drug policy reform outside of SSDP was getting involved in political parties in Ireland. I think especially at the moment, there's a lot of discussions within political parties around a lot of policy reform, not just explicitly related to drug use, but also around nightlife licensing laws, which you can sort of bring in drug policy too, which is a really important thing, which I think is being ignored in a lot of discussions at the moment about extending nightclub opening hours and stuff like this in Ireland. And yeah, there's many great parties doing really great work, to be honest. I was in People Before Profit, Socialist Party in Ireland, and that's sort of how I brought drug policy into the party a little bit more, especially at a sort of local level with my local branch. So I won't necessarily suggest a party for you to get involved in, but I think that's one good way. Obviously, Students for Sensible Drug Policy is another.
Thanks so much. And yeah, if you want any help with getting involved in SSDP in Ireland, let me know and I'll definitely help you out. Okay, our next question is from Trixie, or Beatrix Voss, which I feel like I have to say your full name, even though I think many of us know who you are. So Trixie says, I tend to feel like both women's rights movements and drug users' rights movements are both hesitant to advocate for human rights of women who use drugs. Is this your experience as well? And if so, why do you think that is? And how do we overcome that? So it's a question for the panel. So I'll leave it open if anyone wants to grab it.
If I can jump in here, I have some thoughts on this. I think it's because we often focus on this goal, which I think is wrong, the goal of ending drug use, and like moralizing the issue of drug use and, you know, making it seem like a person who uses drugs is a bad person. And then it gets really harsher when it comes to women and femmes in general. So, you know, if we start to actually shift away from that, like, tendency to try to moralize someone's drug use, we can finally get away from this urgency to, like, you know, ascribe morality to women who use drugs and the fact that they, you know, should be benefiting from human rights, and that shouldn't be taken away from them just because they use drugs. I think, you know, until we actually really shift our culture and our society away from the socialization of drug use being such an immoral thing, we won't see the end of, you know, laws criminalizing people who are pregnant and using drugs, and we won't continue to see, you know, laws popping up that are criminalizing all kinds of marginalized folks in alignment with drug use. So I think it really is steeped in the fact that society wants people to stop using drugs, and especially certain people.
I would
Thank you
also
so
like to,
Yeah.
sorry, Róisín. I would also like to add on this, because I feel Trix and I may have quite similar experiences being neighbors almost, in terms of our countries. I think in terms of the women's rights movement in Romania, from what I've seen, women's rights is already quite a sensitive issue there. Romania has a legacy of banning abortion for more than, I don't know, 20, 30 years, and has quite a history of being, you know, the leader in human trafficking, at least in Europe. And there is a lot, and I think rights of women who use drugs tends to be overshadowed in the women's rights movement, and I think they are often actively avoided just because there are so many steps that need to be taken when it comes to domestic violence, reproductive rights to an extent now, not necessarily as it was in the past. And it's just feminism in general is not that much of a conversation. And when it comes to the drug user movement, what I've seen is that they tend to use women more in mothery roles and tend to avoid images that might affect expectations, traditional expectations of what women should be. So what you'll see often is interviews of mothers that, for example, have lost someone to an overdose, or have had someone in addiction or committed a crime because of drugs. And that's the way they're trying to dehumanize. And those are valid perspectives, but are not the only perspectives that exist. But I guess those perspectives will change, and the things that we're going to see, the kind of voice empowerment that we're going to see is probably going to change in the future once discussions about women's rights in general and discussions about drug users' rights become more destigmatized and more available to the wider public and more embracing.
Okay, Róisín, I would like to say something about Beatrix's question too, and I'll have to answer from my perspective here in Africa, Nigeria in particular. I can actually say our problem is compounded in Africa because we have some language barriers in the educational platforms for things like this. It's not really the situation that women rights movement shy away from fighting for human rights of women who use drugs. But to thrive in a country like Nigeria, you need to be very careful of how you tread, especially languages, the education that you pass across, the message you are passing across. So the first thing that we always try to consider is how to make them understand that they are not criminals, the fact that they use drugs and all of that, because most of them, because of the norms in the country, because of the norms that happens every day, they already feel like criminals. So they are not able to come out, they're not able to mingle as they should. So but then we have so many restrictions in Nigeria. Our government's always on us, especially when you have a movement like that, and the languages that you're speaking is making them look like you're a rebel. You're trying to change some things that are not meant to be changed. So it's not we shying away from things like that. It's not we shying away from fighting for their rights, but it's the way the message is being passed across. We need to tread with caution. I also saw Chidi's question about sex workers. We cannot deny the fact here in Africa that we are a morally orientated country. Whatever we do, wherever we move, we are morally defined. People want to say they are clean in this aspect and they are religious in this aspect, and you have morals, you have cultures that will always put you through things like this. So talking about the right of sex workers that use drugs is a very difficult conversation in our society. You gather people and you start that kind of talk, it makes you look like you're one of them and you're advocating for these things because you like it and because you encourage it. So it becomes very difficult. And that is why I believe that even though there are developed countries that are ahead of us, we will definitely get there through the right education and the right information to the public. So these are things that we look forward to, and that is why conversations like this are very, very necessary in Africa and in Nigeria in particular. That's all I can say for now. Chidi, thank you for your question. Thank you, Beatrix.
Thank you so much. And yeah, I totally agree with your point. The compounded stigma, I think, is always the thing that gets, it's what crossed my mind as soon as I saw Trixie's question of like, often I think progressive movements don't like to intersect with other progressive movements for the fear of looking too progressive, and then being undermined. And I think that often happens. But if there's anyone else who wants to come through on Trixie's question, but I'll also read out Chidi's question for anyone who might want to bring that in as well. Chidi said, I feel the rights of sex workers who use drugs are often neglected, especially in Africa, where there is prejudice against sex workers. What type of policy framework could best suit the rights of sex workers who use drugs? If anyone wants to come through on that, please do.
I think I'll jump in on that, although obviously can't really speak for the situation in Africa, as you touched on in the question. But I think when we think of policies that really work for people who use drugs of all kinds, what matters most is not really, like, look at Portugal, for example. You know, decriminalization there is a really great success story that people point to a lot. But the success of the story is really in harm reduction and investment into harm reduction services. When you look into Switzerland, they've had massive success since around the 1980s, I think, when they had a massive HIV problem as a result of injecting drug use. And the reason that is successful is investment in harm reduction. So I think the key is firstly removing like legal barriers around sex work that might prevent sex workers from accessing services or that criminalizes them. Similarly with drug use, removing criminalization of drug use for sex workers who use drugs, obviously. But what you do after that is what's important as well, and making sure that harm reduction is available. It's low threshold. You can provide it where sex workers are. I remember when the injection facilities, which I mentioned before, were coming in, I was looking into practices around this, and I saw, I can't remember the exact figure right now, but they said the average distance people who use drugs will travel for services is like 5 kilometers or something like that. I'm not sure how much it was exactly, but let's say that. But just ensuring then, in this case, that these services are available where sex workers who use drugs are. Same for all people who use drugs, making sure they're available in a local place for people who use drugs, and making sure they can meet the needs of sex workers. Sex workers will have really nuanced needs. There's a couple of places I think who actually have specific hours for drop-in centers for sex workers, and they have people there who are trained to really meet the needs of the sex workers. So ensuring there's stuff like that available, ensuring that there's integrated STI testing, that there's other facilities that are necessary for sex workers that they're demanding integrated into the harm reduction services, rather than having a lot of decentralized services available to sex workers. I think stuff like that is what's really important when we consider how do we make policies work for sex workers who use drugs.
Thank you so much. And I think the distance thing is something that I don't think always comes into consideration with governments when they're making those decisions. Especially like being also from Ireland, looking at how Dublin is like the center of harm reduction and its very limited capacity, leaving the rest of the country aside. And I know it's very similar, like pretty much everywhere. But yeah, does anyone would anyone else like to come in on the talking about harm reduction and the best policy frameworks for sex workers who use drugs?
Okay, so in addition to what the Ailish said, so I can as well, I want to support that. There's the need for us to, especially in Africa, based on unfavorable drug policy that we have, I think we need to, first of all, lay the foundation. And how do we do that? We need to tackle, or should I say, address the unfavorable policies that we have at first. So that would, in a way, make it easier for us to reach out to people like sex workers who are part of underserved communities. That would make it easier for us to reach out to them, because if we do not lay the foundation by establishing like quality drug reform policies, I do not think we are going anywhere. So I believe it's really important to take note of that, and also to embrace sex workers and people in the category, in this category. There's need for us to embrace them and to also like consider them in the society, because I believe the reason we ignore some persons, or the reason we feel that some persons should be prioritized over the other is because there are some certain things that we've kind of normalized and we've seen as, okay, this is the normal thing. So if something else pops up, it's kind of like strange and we see that as weird. So we as individuals, we need to embrace them and consider them. So I believe that would also help.
And maybe if I could just jump in to just agree with the two ladies. I like what Ailish said about the intersection of drug use and sex work. It's very important, and especially in Africa, this is something we don't like to acknowledge, that very many drug users identify as sex workers and vice versa. So in integrating services, allowing there to be services for sex workers where drug users are and vice versa, and also finding that convergence point, which of course for us is HIV. So using that convergence point to make it known that this is an issue, and then using the human rights-based approach as we've been using in the different sections, and also building a strong community of both sex workers and drug users, having that network be strong enough so that when one section is advocating for better policies for themselves, then the other one gets heard as well. Because really it's and especially in Africa, you'll find that a lot of sex work is I don't want to say forced, but not by choice. And the same thing for drug use. So problems will lead you to sex work, problems will lead you to drug use. Acknowledging those unique circumstances and building a strong case and a strong community for them, then makes it easier for us to move forward, especially in a society where decriminalizing sex work will take time, as well as decriminalizing drug use will also take quite some time. So thank you very much for those points. It's thank you.
Thank you so much. Just a reminder, please put more questions in. We've got a couple of minutes left, so we definitely can go through. We have one here from Ville Marie. So what can women do to support other women who use drugs? Which is open to the panel, if anyone wants to jump in on that.
Yeah, I can.
I would want to say,
no, go ahead. Go ahead. It's fine.
I was going to say not to pass judgment on people, and even amongst drug users, not to pass judgment based on the substance that you use versus the substance that another person uses. Because even amongst drug user spaces, people pass judgment based on different substances. So I would say support people, don't pass judgment, and just be there for folks.
Yeah, I would say just like listen to other women and women who use drugs, like listen to our experiences, like help elevate our voices, yeah, like we like I've often like come into conflict with other women in the drug policy reform movement, and I feel like there's kind of like this weird like sense of competition amongst us, and like we shouldn't be like competing like against each other. Like we should be working together and like supporting each other and like uplifting each other, and like just like support other women in the drug policy reform movement, and like lift up other people's voices, especially if you're like more privileged. Like you should be like lifting up the voices of like people in different marginalized groups instead, right? So like I guess knowing when to speak and like knowing when to not speak. Yeah.
Would anyone else like to come through on that one?
Yes, maybe just, sorry. Odunola, you may go ahead.
Okay, thank you. So I just wanted to buttress on the fact that we should respect everyone's decision, because we have reasons for maybe choosing to do a particular thing. So I believe the way we can maybe support each other or one another is by respecting our decisions and just accepting us for who we are, and to just accept us, because I believe the reason we make individual decisions is basically to maybe find happiness and peace. So respect is key.
Well, you said it, but yes, just to add to that, maybe just ensure that our organizations are strong. Just build very strong, impenetrable communities that involve women who use drugs in every aspect of decision making. and keep it going, and make sure, and with all the things said, respect and all that, and diversity. Yeah.
Thank you so
I'm
much.
also going to go with what Raquel said. Women, we need to know when to speak. We need to know when our advice is needed, because some of us get into positions and just feel we can feel the pain of the other woman, even when we can't. So we need to know when it is right to give that advice that you think you should give. And just as Raquel said, there's a time to talk. There's a time to just sit down, sit back, listen, and be in the person's shoes. Feel what the person feels, even before you try to make moves to say anything concerning the issues that are being told or being discussed. So that's all I have to say on that too.
Thank you so much. And Queen, I really like what you said in the chat. And if you want to bring it to this space, you're welcome to.
I just wanted to quickly mention that, womanhood for me at least is not limited to, the cisgender experience. And I think it's going to be really important as a society to get beyond the binary and actually start to understand the experiences of femmes across the binary. And I think it's going to be really critical that cisgender people also step up to the plate to also speak out against transphobia in our spaces and beyond.
Much appreciated, and a very strong point. Yeah, if anyone wants to jump in on that question, I think we might even have time for another question if anyone wants to throw one in. We could feel free to. I'll give it a moment.
I can also jump in on the previous question, and maybe just from my experience of living in Romania. I think it's important not to assume that just because you're a drug user and as a woman, you're sort of failed in your sort of role, whether it's as a mother or other expectations that the society has of you because you're a woman. I think that's fundamentally one of the greatest mistake that we're making, is that we fundamentally see these people as failed persons, when in reality that's not necessarily the case. I have met a lot of women that are very accomplished or are great mothers and have amazing lives, but for example consume cannabis, but they're not failing in their role. And it's important to see women as fully fleshed, complex human beings that are not only defined by their drug use, or don't necessarily have problematic drug use if they choose to consume drugs. And I think that's important.
Thank you so much. I think we'll go to kind of begin it. We're in our last couple of minutes, so I think we might begin to close up. I'm going to ask our panelists to share maybe a last thought or a last message you want to impart on the group. I know it's a really terrifying thing to put everyone on the spot to do. But if you have kind of a last thought that you feel kind of wraps up your thoughts, please share it. I think maybe we'll start with Iulia, since you were the last to speak there. If you have something you'd like to share.
Sure. I think I just wanted to say that I'm glad that I was introduced to drug policy in a space that is quite dominated by so many strong and inspiring women that have shown me a lot and have taught me a lot. And I do hope that there's going to be more room in the future for women drug users to become involved in these movements and have their voices amplified and heard and elevated. and I'm extremely grateful to be here, and I do hope we can make change from a women's rights perspective and a drug users perspective as well.
Thank you so much. That was really beautiful. I think maybe we'll go next to Odunola.
Okay, so I just would like to say that we all have the liberty to choose what we want to do, so long as that makes us happy and joyous. So I can say that I'm happy that I'm here. Like, I've learned a lot of things from different people who shared their ideas, and I just would like to say, should I say, I'm speaking on behalf of like other advocates right now, because I'm also a part of them, and I'm saying that we should keep on advocating for what we like, because I believe that even if we are seeing like gradual, slow change now, I believe in the next maybe decade, things would be fine, and we would really say all our efforts are maybe well deserved. So
Thank you so much for that. I think we'll go to Rita next.
Okay, well, first, just to say, you know, the struggle for rights, for women's rights, has come such a long way, and it's really wonderful to see all these women in a space that's traditionally male. Of course, as much as there's more traditionally male drug use problems, the human cost of the punitive policies is borne by women. So it's really good to keep doing what we are doing. All I know is how to bulldoze, which is what we've had to do to get to this point. So let's keep bulldozing, let's keep working together. I'm very glad to meet all of you, and I hope we can keep you know, bumping heads and picking each other's brains in different contexts, and to see the way forward. So really good work, everyone. Thank you, Róisín, for this webinar. And yes, let's keep doing this. Thank you.
Thank you so much for that. I really like the sentiment. We'll go to Queen next.
Yeah, I think I'll just want to end this conversation, you know, amplifying all the voices on this panel and thanking everyone for sharing their experiences. You know, I think moving forward, I have a lot of pride in being a young woman in the drug policy space, and want to leave people with the fact that we should be making a path for other women to be entering the space and feeling empowered in the space. So don't ever feel comfortable just being the only person in the room. Like, you're not, I think we're not doing our job if we're not making paths for other people who are like us, or other marginalized people to enter the space that we're in.
Thank you so much for that. And I really believe in what you said, you know. Next we'll go to Rachel.
Yeah, so I want the men on here to take away with them, like give like listen to women, like help it, you know, like maybe like sometimes like take a seat so a woman can, you know, take your spot. Yeah, so, like listen to us, right? And then talk to other men, because like men listen to other men, right? So that's what I want the men to take away from this.
Thank you so much for that. I think we'll go to Lillian next.
Okay, so I don't have much to say. I'm really excited to have learned so many things today, and I actually hope for a world where we as women would choose to challenge. There are so many things to discuss. There are so many things to be talked about in the women's space. There's so many issues that bothers around women that we are that are being sidelined at the moment. So I just want to hope that the International Women's Day hashtag of this year, 2021, choose to challenge, that women actually stand up to challenge some of these situations. And I'm really glad that in our own capacities, we are doing different works in the world to change the norms. So I just want to encourage everybody on the platform to continue doing what we are doing. And there are so many challenges ahead of us, but then at some point, I know victory is ours. It might take a long time, but then with platforms like this, with programs like this, educational programs and conversations like this, we are surely going to do well at the end of the day. So I'm really excited, especially seeing familiar faces. I'm so excited to be in this panel. Thank you very much, Róisín, for this opportunity. Really grateful. Thank you.
Thank you so much. And I think we'll go to Ailish to give us our last final sentiment.
Well, a lot of pressure. Yeah, when I was thinking about this panel, I was actually thinking in my head about how many amazing women there are working in drug policy and how many amazing women who use drugs there are in this field. Like there's actually quite a lot of even people leading organizations. If you look at International Drug Policy Consortium, Harm Reduction International, International Network of People Who Use Drugs, these are all led by women. And these women are experts about themselves, about their drug use if they are women who use drugs, and about the issues facing women who use drugs. So it's just really important to I guess realize how many fantastic people there are out there. I remember when I first started doing this work, I was really starstruck by quite a lot of them. So it's fantastic to get invited to stuff like this and be able to speak and be considered among them, I guess. But yeah, there's a lot of great people out there, a lot of great women, and it's important to listen to them and kind of realize how fantastic the work that a lot of them are doing is.
Thank you so much. And just to confirm, I haven't missed anyone this time. I really hope, I think I got us all this time. I'm so sorry for that earlier. But thank you so much to all our panelists for being really incredible and powerful in what you've said. It's been, I think, yeah, it speaks for itself. You guys have been amazing, and this has been really great. I'd like to thank Moranflu Adesuyi for organizing this panel. Moranflu is an incredible event organizer and has been killing it recently. So thank you so much for making this a reality. And yeah, I think happy International Women's Day, everyone. And I think that brings us to the end. All right, well, thank you for a lovely call, and good night for all of those of you in nighttime, and good day for all of you in daytime. Bye.